Should I have weight loss surgery? And if so, should I do it before I get pregnant or after? Let's talk about it. Hey everyone, it's Dr. T, and today we're going to talk about a very important topic. In fact, this topic is so important that about 2/3 of Americans fit in the category of patients we're going to talk about today. So today we're going to talk about weight loss surgery. This is a question I get often in the office, and now we're starting to see an increase in the number of moms who are pregnant after undergoing some form of weight loss surgery. So just to give you a sense as to where we are, we know that over 2/3 or about 2/3 of Americans are either categorized as overweight or obese. These are medical terms that help us to distinguish those who may be at increased risk for having cardiovascular disease, certain types of cancers, certain problems with their joints. And so it really help us identify those who may need to be monitored closely or identify those who may need certain screening tests because of their increased risk. Today, we're going to focus specifically on the relationship between pregnancy and these weight loss procedures. But first, let's get a little better idea as to what these procedures are and how they work. So I am by no stretch of the imagination a bariatric surgeon. So I will be speaking on these procedures from a foundational perspective, and then we're going to hop into the relationship with pregnancy, just to give you a little bit of an overview. If you're joining us for the very first time, or you may have missed a few videos, you may want to hop back and go back to a topic we did at the end of the previous year, in which we really worked out the topic of obesity, what it means, what it reflects, what it's intended to reflect, and the risks are associated or the long-term complications associated with it, and just how our communities of color really deal with this particular medical condition. And we talked about all the factors that really lead into obesity. It's not just what we eat, it's not just how we move. Though those are very important factors, they are not the only factors. So when we talk about the word overweight, we must first get a reference as to what is normal. So we use a calculation called a body mass index, and it's really a relationship between your height and your weight that gives us a number that then correlates to these outcomes that have been studied scientifically. And so it correlates to certain types of cancers or certain types of cardiovascular disease. Certainly, we are very familiar that the word that an abnormal weight has been associated with things like diabetes and hypertension, which are very prevalent in our population. The word obesity refers to those who have a body mass index that is equal to or above 30. A normal body mass index is anywhere from 18.5 to 24.9. And then overweight is 25 to 29.9. We talked about previously that there are some exceptions to individuals who may have a body mass index that's a little bit higher, but in fact be fit and healthy. Again, reference our previous videos to find out more about that topic. I should mention also, if you believe that you're a fit mom, and that the BMI doesn't adequately reflect your healthy lifestyle, then you may also want to consider other modalities of evaluating your percentage body fat. There are other methods of doing so. There are other indicators that can be used, and this we talked about previously as well. But in general, for most people, most Americans are not eating healthy. We know that most Americans are not moving and exercising on a regular basis. Some due to some disparity barriers, and others for other reasons. And the reasons are quite a lengthy list that we're not going to go through today. Nonetheless, this is, for most Americans, this number gives an accurate reflection of the lifestyle. And it is used to help us to provide better care by identifying those who are at increased risk. When we talk about weight loss surgery, We do know that individuals tend to have a better success rate the more they adapt to a healthy lifestyle before they have the surgery. So a lot of weight loss programs may actually require a certain percentage body weight loss before having the surgery. Part of that is to make sure that the individual has adapted to a healthier lifestyle, or that those social barriers or medical barriers have been addressed. In general, the criteria for surgery is dependent on your body mass index, particularly those who are considered to be morbidly obese. And that word, you guys tell me how you feel about the word morbid, but it refers to someone who has a BMI of 40 and above. Those who have BMIs of 35 to 39.9 may qualify for the surgery if they have a secondary outcome that is directly linked to their weight or their BMI. So that may be someone who may be hypertensive or obese, may have joint issues. And certainly we have known that those who are in class 1 obesity, that is your 30 to 34.9, if they have severe conditions as a result, are linked or affected by their obesity, then they may in fact qualify. Definitely check with your insurance company to see whether or not your insurance plan actually covers the surgery if this is something that you are looking into. And we know that obesity disproportionately affect certain populations. So we know that Black women and Mexican women are at increased risk or have higher numbers of individuals who are affected by obesity. So when it comes to pregnancy, we know that moms who start out being pregnant at a higher body mass index are in increased risk for certain outcomes. Some that we more commonly speak about because of the high prevalence include your diabetes, your hypertensive disorders, including preeclampsia, chronic hypertension, and gestational hypertension, as well as preterm births. So interestingly, when it comes to preterm births, we're not talking about spontaneous onset of birth. We're talking about those who may have some medical condition or some complication that indicates the need for preterm delivery, either due to mom's health or the health of the baby. So that's unique about patients who are obesity. We're not talking about spontaneous onset of preterm birth or preterm labor that leads to preterm birth. We're talking about those who have a medical condition that leads to the necessity of having a preterm birth. Okay. Also, we know that there's an increased risk for miscarriages. We know that there are increased risk for delivery complications, which includes a higher rate of cesarean section. Secondarily to that, there's an increased risk for wound complications in patients who are obese as well. So certainly one thing does lead to another. And this is why oftentimes women will consider having weight loss surgery before having or getting pregnant. Before we get into the outcomes as a result of having weight loss surgery, let's even go over what these weight loss surgeries are to begin with. So we know that there are categories of weight loss surgery, and you may be familiar with one or two, or maybe a combination of a few of them. So weight loss surgery are either going to restrict the size of the stomach or is going to redirect or bypass to some degree the small bowel. And why that's important is that restricting the stomach is reducing the ability to consume the certain amount of food, whereas bypassing the small bowel will lead to what we call malabsorption, so a decrease in the absorption of foods. And why that's important is because knowing what type of weight loss surgery someone's interested in or someone may have had will then lead to how we manage that particular individual in the pregnancy. So weight loss surgeries are not necessarily managed exactly the same. In fact, we'll spend more time talking about a combined approach, which is called your Roux-en-Y, which is both a combination of a restrictive procedure as well as a malabsorptive procedure. There are procedures that are purely restrictive procedures that reduce the ability to consume a certain volume of food. One of the common ones is called the gastric banding procedure. So the lap band procedure is basically, if this was your stomach, it is taking a inflatable device and putting it around your stomach, and that leads to a reduction as this implantable device is tightened. It results in a reduction of your the amount of food that will fill into your stomach. So you get full quickly. And so it reduces the amount of food that you have a desire to eat and the amount of food that you're actually able to eat. Then you have other surgeries like the gastric sleeve, which then takes the same stomach and it will cut across the stomach, leaving only about 20%. Most studies say that if most procedures are done where 80% of the stomach is removed. So there's nothing that's bypassing the same connections from the esophagus into your small bowel exists. It's just reducing the amount of space that your stomach has, and so ultimately reduces your signals in terms of whether or not you're full, and reduces the amount of food that you will consume at a given time. Then you have procedures that are bypass procedures. We're not going to focus on those because they're becoming less commonly done, but we will focus on a combined procedure called the Roux-en-Y procedure, which does a combination of taking a small portion of your stomach, bypassing the remainder of your stomach, and implanting lower down in the small intestine, which does lead to some malabsorption. And so the reason why that's important, whereas the other categories of procedures will reduce the amount of food someone consumes, they don't really impact the absorption of the nutrients out of those foods, whereas the Roux-en-Y does have an impact on the absorption of the amount of nutrition from those foods. And so in these two groups, you will monitor weight gain and weight sustainability in one group, whereas the other group, you should also be concerned about their nutrition. And that's important to keep in mind. We will also highlight just some important factors and things that we should consider in addition to that as well. So how effective are these procedures? Why do people undergo these procedures to begin with? Well, they're pretty effective in reducing excess weight. So what is excess weight? When we talk about excess weight, we're talking about someone's current weight minus their ideal weight, and that will give you their excess weight. So in the cases of most individuals, the goal is somewhere, most studies will say somewhere between 50 to 75% of their excess weight will be lost. And why is that important? Is because that means that most people will sustain some level of excess weight. And so not everyone or most people will not necessarily go back to what's considered to be an ideal weight, and will still have some level of excess weight depending on how successful their surgery is, and also just a number of other factors, right? Their height, their weight, their BMI to begin with will determine the rate in which they lose weight. And we also talked about the lifestyle that they're able to maintain. If someone's able to maintain a healthy lifestyle, then they're more likely to be successful after having these procedures. So in general, we recommend that for an individual who's considered to get pregnant to wait at least 12 to 24 months after the procedure before getting pregnant. And the reason for that is twofold. One, you want to make sure that the patient has the opportunity to get to that ideal weight that may be the goal. And two, you don't want someone to be pregnant while they're actively losing weight or drastically losing weight. So just to give a sense of how the weight loss happens, you have what's called the honeymoon phase. The honeymoon phase is during that rapid weight loss time period. So most individuals will lose most individuals will lose weight at a faster rate during the first month after their surgery. And this is a combination of their healing. They're usually on a liquid diet. And so the combination of the two usually leads to that rapid weight loss. By the third month, most individuals will have lost somewhere between 30 to 40 pounds, or somewhere between 25 to 35% of their excess weight. And so by the 6th month, most individuals will have a lower rate of the reduction in their weight loss. They would typically lose about about 45% of their excess weight at this particular portion. And as they continue on, that weight loss rate will continue, but at a slower rate. Most individuals, by the time they hit their first year anniversary, would have lost somewhere between 50 to 60% of their excess weight and will continue to head towards their goal, which most individuals will hit by their 24th month of after surgery. And so when someone's going through that rapid weight loss, it's really hard to sustain a healthy weight for a growing fetus. And so you want to make sure that these events have occurred before someone is considering to get pregnant. So interestingly, some studies have shown that even though some patients undergo bariatric surgery, bariatric meaning referring to weight loss treatment. So baros is a Greek root word, which means weight, and iatric refers to medical treatment. So that's how you get the word bariatric surgery. So for those who undergo some form of bariatric surgery, they have found that compared to the general population, these individuals will still have a higher rate of diabetes and cesarean section, and certain outcomes that we talked about just previously. So why undergo the surgery? Well, the key is that there is a decreased rate in some of these outcomes when you compare someone before and after their surgery. So we know if an individual undergo a bariatric surgery, that they're essentially decreasing their risk or likelihood of developing some of these outcomes that we talked about. We have known that studies have shown that there is a decreased rate in gestational diabetes as well as hypertensive disorders, and that the average weight gain for individuals who have undergone the bariatric surgery is at a lower rate compared to those who have not undergone bariatric surgery. So when you compare before and after, their weight gain is much better after the surgery. And so a healthier weight gain for mom means a healthier weight gain for baby. And that's why that's important. So on the clinical side, there are things that we have to be mindful of given these statistics, right? And so we know that individuals who have some form of bariatric surgery, depending on what type of surgery they've had, should be monitored for certain things. So we want to make sure that the patient is actually having a weight gain at a healthy rate. So that's one of the things that we'll monitor for. We'll also monitor to make sure that the baby may be growing appropriately. So that individual may undergo serial ultrasounds to monitor the growth of the baby, because of the higher risk with this particular group of individuals. And then, to keep in mind that, as we mentioned, most patients will lose a great amount of their excess weight, but may still be actually obese at the time of their pregnancy. And so, as we mentioned before, obesity in of itself has increased risk outcomes. So they will continue to be monitored for these outcomes. Which require early screening for diabetes in some cases. It may require low dose aspirin we talked about previously. So there are certain things that they will continue to experience even though they've had bariatric surgery, if they are still, especially in the category of obesity. The other thing to keep in mind is that these procedures in of themselves make the pregnancy a higher risk pregnancy. So what's important to do is for anyone who has any type of GI symptoms, whereas normally if someone hasn't had a surgery like this, we would evaluate for the common issues associated with pregnancy or associated with whatever other underlying medical conditions they may have. But bariatric surgery also brings a new perspective a new set of possibilities to that individual. So someone who has GI symptoms, nausea, vomiting, abdominal pain especially, we like to get a bariatric surgeon involved early just to evaluate whether or not their symptoms may in fact be related to their previous surgery. For those who have lap band procedures, sometimes the surgeon may decrease the amount of fluid, allowing for an increased filling of the stomach with the lap band. So those are decisions that are in evaluations that can be done by a bariatric surgeon that works in conjunction with us during a patient's pregnancy. As mentioned, certain types of procedures especially the malabsorptive procedures or the combination procedures, will also affect someone's ability to be able to get sufficient nutrients. And so there are certain vitamins that are followed, whether it's your B12, your calcium, your vitamin D, your iron, in those particular individuals to make sure that they are getting sufficient nutrients. The other thing I do want to highlight before we wrap up is the fact that in the malabsorptive group, you also want to be mindful of medications. And so if someone is on a medication, especially like your seizure medications that have to be in a therapeutic range for them to be effective, having a previous bariatric surgery that leads to some type of malabsorption, that does have to be kept into consideration and likely monitored to make sure that we're able to keep the patient medication in the therapeutic range in order for that medication to continue to be effective. Likewise, we also may prescribe a vitamins or a vitamin regimen that's different than someone who doesn't have bariatric surgery, just simply to make sure that they're able to get sufficient nutrients. There are now prenatal vitamins for individuals who've had bariatric surgery. So keep that in mind as well. And also, you also want to keep in mind that some individuals may not tolerate certain tests that we do during the pregnancy as a result of the malabsorptive aspect of their procedure. So certain screening tests like your diabetes may be modified. Your diabetes screening may be modified in this particular group because of these related concerns. And the other thing to keep in mind, and this especially affects our adolescent group who may have had bariatric surgery, and y'all, we got to do better that our adolescents are now requiring bariatric surgery, but that's a whole different conversation. But if you do have an adolescent that has undergone some type of bariatric surgery, especially with the malabsorptive group or subgroup, you do want to make sure that if they are sexually active and they do not plan to get pregnant, that they are offered other forms of birth control that does not have to be absorbed, because we have noticed higher rates of pregnancy in the bariatric group, likely due to a reduction in the absorption of the oral contraceptive pills. So in this group, you may want to consider using some other form of birth control for that particular purpose. That being said, bariatric surgery is quite a difficult decision for an individual. It's not an easy lifestyle. Again, the individuals who tend to undergo bariatric surgery are those who really are either looking at a significant risk for secondary outcomes like stroke, heart disease, diabetes, high blood pressure issues that really affect your longevity of life and your quality of life. And it's not an easy decision. It's also not an easy decision to have that procedure for individuals who are considering to have a family. And there are lots of things to be considered, as I have shared with you today. I hope this gives you a nice introduction as to some of the things that should be considered in your decision-making when you decide to have the surgery. And if you decide to have the surgery, whether or not you want to undergo the surgery before or after pregnancy. Certainly the outcomes are in general better in this particular group of patients after pregnancy. I also want to know what you feel about the word morbid. So when we talked about class 3, we're starting to change the terminology and use the class terminology, class 1, class 2, class 3, in terms of the severity of obesity. But it had been traditionally known as and referred to as morbid obesity for those who are in the BMI group of 40 and above. And that group has been growing, just like the percent of obesity in the United States has grown significantly. And that has led to higher numbers of bariatric surgery, which when it first started was only just a few thousands. Now we're in the 100,000 range of individuals who are undergoing these surgeries annually. So definitely the need for the surgery has increased, but it's truly a reflection of the health of our population. And there are ways that we need to support individuals who desire to lose weight in a more healthy and less invasive way. But as we talked about in our previous discussion, that is a very layered topic when it comes to people of color and our experience and disparities on so many levels in the US. Nonetheless, the fact that we're identifying these areas give us an opportunity to address these areas so that we can all have better outcomes and so that we can all have healthier pregnancies if that is a person's desire. So I thank you for joining on today. I hope I've brought some enlightenment to this decision and to the experience of individuals who are dealing with excess weight. And I hope that I've brought some clarity in your decision making to undergo or whether or not to undergo these procedures. Whatever your decision is, I wish you all the best on your journey. Thank you for joining on. This is Dr. T, again, the hand behind the handle of Healthy Bump Club on Instagram and Healthy Bump Club right here on YouTube, where you are viewing this video. We thank you for joining us, and we also encourage you to check out our other videos. As I mentioned, I referenced a couple of the videos we did previously because we tend to layer our content. And so even if I don't go into a particular topic on this video, doesn't mean it hasn't already been addressed on a previous video. So I encourage you to go through our catalog of videos, our library of videos. There's so much resources out there that we are making available on this platform. So our goal is to make these make this information a little bit more palatable to you, and hopefully make your journey a lot easier. If you want to support us, we are partners with Apple Music. Be sure to check out our link in the description of this video where you can purchase your Apple products. Using our link allows us to be able to further support the cost of keeping this platform going. And if you want to support us directly, also use the link to purchase one of our apparel items. So you can get a tote bag, a hat, a sweater, a t-shirt. We got options for you guys. We got options, okay? And we thank you in advance for considering that option as well. And don't forget, we still have a fertility video. So if you are planning your pregnancy, and we go into some of these topics even on that video as well. That video is layered with information as a woman plans to get pregnant. We talk about everything from preparing to get pregnant to how to get pregnant, your questions you should ask mentally and emotionally. Okay, the real deal. We tend to not really address that part of the pregnancy preparation as much in the office as we should. But certainly there's an emotional and a psychological aspect to getting pregnant, and so important that the readiness of pregnancy includes that. So go ahead and check out our video. And as always, we thank you for joining us, and we hope to see you in next episode.